Time to stand back up.
Next. I don't have much, just an update on the doors. Next Tech should be here today. They were planning on it. I haven't heard from him yet, but he's gonna start looking at that. Nobody really has an answer, but they haven't been on site either. It's kind
With
of hard
that striker on that door is what you're talking about?
Yeah, or it's dragging down there, so everything else is working great. No complaints, cameras are awesome.
You might let Ed and Roger know that camera kind of paid for itself the other day.
It did, had a theft in the building, and without it, we may not have caught that person, so I think it's probably already paid for itself.
Well, I'll just tell you the whole story. Shelley's office door was cracked open, and her purse was underneath the chair, and she come back in, noticed something had been kind of moved around, and there was some personal items and money taken from her purse, and the individual actually left the building and came back and right back into her office and rode the elevator with her up to the sheriff's office. And they went back and looked at the tape, and sure enough, they had every bit of it on tape, so, and he confessed. So
It's a good thing.
That was probably money well spent through her.
Yeah. So hopefully we'll get something leave today on that door strike,
Okay.
and I'll let you know what they come up with. And
All
they've
right.
heard about 3 different ways we could do it, and so I think between the three people involved, we'll figure out a good answer. So dispatch had a catastrophe through the night. I kind of expected it. One of the fans in one of the big battery backups is crapped out, so it's not huge. I got it ripped out of there this morning, so I got one ordered. I think I can fix it, so
Okay.
nothing major as long as we can keep it cool between now and Monday. So, and I've been working with a guy on this new app for routing for officer emergency services, basically. So when we get that finished up, I'll let you look at that. It's pretty neat. It's pretty amazing what it'll do. So pretty excited about that. So that's about all I got.
All right. Thank you.
Thanks, guys.
Okay, Alicia and Julie, I think we're ready.
Good morning, Commissioners.
Good morning.
Good morning. Leslie, you are the county attorney that is taking over Nicole's place. Is
Yes.
that correct? Nice to meet you. I'm
Thank
the
you.
insurance agent for Cheyenne County. Always pass these out.
How are
Thank
you?
you. Good, thank you.
Let me get this on. I wanted to introduce the commissioners and everyone to Julie. I call her the numbers person because she works the numbers and does a real good job at it. So I'll let her go over this quarterly review.
Okay.
Since you had to listen to me last time, I'll let her talk.
Thank you, Alicia. Wanted to do a mid-year review. So the first page, we will have what we projected at the beginning of the year on numbers for the $1,000 deductible plan, and then 80% to $1,500, keeping the office visit copays at $25 for primary care, $50 for specialist, and your prescriptions at $10, $35, and $60. What we had projected, what your actual costs were. This includes the premium to United Healthcare, all the administrative fees, and the claims paid. You're running at 1.77% above what we projected. And then on the very right-hand column, as you pay the premium, a portion of that is going into reserves to pay those claims out of. So with what you currently have in reserves, we put that into a 4-tier rate. So when you add all the components of the plan, you add in what's in your reserve account, you're actually running 12.87% under what we projected for January for the first 6 months. So the plan is doing very well. Do any of you have any questions on the plan? On how it's working, something that needs to be done different? I know from our end, the claims are coming in, like I said, running almost 13% under what was projected is very good.
I know from a more of a personal note, seems to be a lot of lag time between notification and payment. I mean, and I don't understand the billing process, especially with healthcare providers, but we've had some services done in April that we haven't been billed for yet and haven't heard a word from insurance. So we're not sure what's
Are
going on.
you speaking of the Denver situation? We've already got a copy of that. And what it is, the provider hasn't probably
So it's a
sent
provider problem.
the bills in because they didn't even know your address.
Well,
The
we're still
provider.
having trouble with individuals, and I've heard others talk about this two-card thing. Providers are having a heck of a time getting that figured out.
Most of the providers that are used to taking two cards, because you have anyone that's on Medicare, they're on two cards. You have anyone that's union, mostly they have the two cards. Sometimes even your TRICARE, I don't know. So it's getting the providers to say, you have to do the two cards. And if they do
And that comes
have-
down to the individual who you're dealing
Well,
with.
Commissioner Rager, a lot of times when Julie and I first set up plans, and mostly, not every single time we're here, but we do stop in at the hospital, the pharmacies. We stop in and talk to them to make sure. But on the Denver provider, it doesn't appear that it's even been sent to any of the insurance companies. So
Okay.
sometimes it's
We'll
easy.
take care of that.
No, Julie, go ahead, Julie.
I've got that.
Okay.
And we'll call the provider. If there's a particular provider that maybe with the two cards, I know, the hospital, the doctor's office, and everybody here is familiar with the two card system. So if there's somebody that you're going to Denver, going into Nebraska, if I have a provider that I can contact, I would be more than happy to give them a call. I mean, that's what we're there for, or if the employees get a billing.
It's kind of hard to convince them that they need.
Yeah, 'cause
The problem is the person that checks you in is not the person that usually that does the billing. So when they check you, oh, we just need one card.
well, it's
And
somebody different every time you go in there.
You're
You
right.
gotta go through the
Yeah.
whole-
Your front desk person, yes.
Gotta go through the whole process again.
what I usually tell people is if they're gonna sit there and they just say we need one card, just give them one card. And then when we get that billing or you get that, then we'll call the billing department and say that we are secondary.
We don't want you in an argument with Susie at the front desk about the two cards. So I've even had some other clients that they actually call me from the provider's office and say they're not taking that second card. And so then I get on the phone with Susie and I said, you need to take the second card if you want paid. And all of a sudden, they've got the two cards in there. So another thing that Julie has in all the employee packets, and I don't know if you've seen, well, I think you have, Commissioner Gardner. In the employee packets, there is a sheet of paper there, and where you can put both your cards on and make a copy of it. A lot of times, the guys will just go ahead and take, I don't have a
I don't
sample of
either.
it.
I don't
But
either.
it's a sheet of paper, and it's on this side of their packet. It has a spot here where you can put both cards. So you put your United card, your Freedom Claims card, you take a copy of it, then you carry that piece of paper to the doctors because it tells them why and what they have to do. Now, I guess we could get a few more of those sheets of paper and just have them to pass out, but it's a really good tool for them to use.
I had one county clerk yesterday told me that that's what she's done for her husband, is she's taken her two cards, made copies, and made several copies, put it in his pickup. So if he ever goes to the doctor or the hospital, he just hands him that one sheet, and it tells you how to file the claim. So instead of giving the two cards, you give him the piece of paper and say, here's how you file my claim.
Okay. Well, that makes a lot of sense. I'll try that, actually.
And actually, I can email that to, email the tutorial. Okay.
Thank you.
Oh, not a problem. If that's what we're here for. If you hear from any of the guys that, or anyone that they're having an issue or a provider, or they keep getting a bill, let us know. Now, one thing that one of the hospitals in one of the other counties that Julie and I deal with, they got a new system at their, a new computer or how programming system. And they would take the 2 cards and put them in, but the system was dropping the second card. So it was only getting billed once. So we've got that straightened out, so.
Well,
But
I'm sorry.
No, go
No, go
ahead.
The only other comment that I've heard is difficulty in pre-authorization of certain procedures. Is there a shortcut route that, how does that actually work?
On the pre-certification, and it's getting to where there's more and more outpatient procedures that are being pre-certified due to you go in one place like an MRI and one provider requesting it, and then they send you to a specialist and they request it again.
Yeah, yes.
Standard in the industry is 3 to 5 days on a pre-certification. If it's something that needs to be done sooner than that, or the doctor says, I want to send you over and have this done, the doctor can do a peer-to-peer review, and that's with any carrier. And the physician's office knows that. If you have something and you send it in and you haven't heard anything, if you contact our office, then we can contact the provider and give them and tell them they need to do the peer-to-peer review, which if the doctor calls in and talks to the pre-certification department, they could get it approved right then if it's something that needs to be done.
But providers know that.
Yes.
Because that's with any insurance company. Okay.
Okay.
So if you have a situation where that pre-certification needs to be looked at in more than the standard 3 to 5 days, then just give us a call and we can help expedite that by getting the doctor's office and United Healthcare together. We do that with all the carriers. Because a lot of times when they very first send in that pre-certification, they don't necessarily say the importance of it, and I know a lot of times in the rural area, you might have the traveling truck that comes in for an MRI, CAT scan or something, a sonogram, that you don't have the availability to just go across town and get it done at a facility. You have to do it the day that it's here. So we help coordinate that for all of our groups.
And these are good points, and I'm always interested in hearing this, because when we do any employee meetings or when we do the reviews where we have the employees here, we will stress certain points, and because they're always very quiet, we will have the employee meeting, are there any questions? So we will stress some of these things about the 2 cards and the peer-to-peer with the providers.
And please know at any time, if anybody has any questions, all they have to do is pick up the phone and call. And we're there to
Very,
answer the questions and to see, to get everything going the direction it needs to go. Okay, any questions on the projected? So running 13%, almost 13% under what we projected. The plan and how you have it designed is going very well. The next one is the savings report. The total, and I think Alicia probably went over this before on how this report works. The total illustrative rates, the $515,952 is what you'd pay in the industry for that $1,000 deductible plan. And the plan that you currently have for the employees, where now with the high deductible, you're only paying $211,914. So you're the one that's making that additional money to pay claims and administrative fees. So over at the very right-hand side is what you have netted through all the components, paying United Healthcare, claims, the fees, $194,812.91 as to what you would be paying.
saved over going to a traditional plan. So if you just went out in the marketplace and contacted XYZ company and said, we want a $1,000 deductible plan, we want this, co-pays of this, what have you, you would be paying the $87,693 a month. But by getting a high deductible plan, you're only paying $35,000. That money then is, you can see how it's dispersed here. So you are actually savings is over here in these columns. So that's what you have. So in the first 6 months, you've got just shy of $200,000 that you have saved over going traditional. And this is not a self-funded plan. I just, I wanted to just tweak on that a little bit. It is not a traditional self-funded, it is not a partially self-funded. This is a hybrid HRA plan where the money that is saved stays with the employer. It's not like an HSA where it goes to the employees, an employee leaves, he takes that money with him. This is an HRA, it belongs to the county, it's their money. So whatever is in this last column is a savings, and that is what is in prior years has been very large. So this is the county's money. Okay.
And if you take, we're gonna jump back behind the very last tab and look at, when we talk about the traditional plan and what you would have saved, the sheet here, behind the very last tab is your benefits. And looking at, and was designed, and that can be designed for the county, and this is where we've come in, the $1,000 deductible and the 80/20 to $1,500 out of pocket. Under healthcare reform, most plans have an out-of-pocket of $6,350. So, and office visit copay standard in the industry for primary care is $35, where you've been able to keep it for the employees at $25, and a specialist copay standard in the industry is anywhere from $70 to $90 now for the copay. So you've been able to keep the employees out of pocket down, but yet still build reserves with the way the plan design is set up. Okay. Going back up.
You're not supposed to jump
I
around.
know.
And I get
I
confused.
am
and I don't know
terrible
where
about
I'm supposed
jumping
to
around.
go.
And actually, if you go behind the first tab, we have this sheet here that talks about the top benefits. And we like to tell you where those dollars are going underneath that high deductible. Prescriptions are always in the top 3. I do not know a plan where prescriptions are not one of the top places where your dollars go. Prescription claims, and then it just tells you how we get those claims in and the number of claims that come in. And we can look at this too to find out if there's any way that we need to tweak the plan this next year to keep your costs down, but yet still give the employee the benefit. And it's the total charges that come in, the allowable, what's paid by the employee, and what's paid by the plan. The next one is just the top providers. So who are your employees using? Making sure that they stay in network, if there's anybody, and where the employees go. So this is the top provider, and it's over at the very right-hand side. It goes from the highest dollar paid down.
And this is a good example on the page just prior to where you are right now. One of the charges is inpatient medical charges. And you see the total charges on that were $239,198. And if you follow it across, the plan being your plan, you only had to pay $4,881. So that is a good from a $239,000 to $4,400.
Unless you're the guy paying it.
What's that?
I'd say unless you're the guy that has to pay the rest of the $239,000. Because if somebody got billed, somebody's gotta pay it.
The insurance.
Mm-hmm.
The insurance company pays that.
I thought you just said you was only paying $4,000.
Your plan.
Your
plan only had to pay that of those total claims.
So the insurance company picked that up.
Correct. Mhm.
All right.
Uh-huh.
Sorry about that, wasn't clear.
I know where your question's coming from is way back when we had all those balanced billed charges.
From the prior
That was,
carriers.
yes.
That was nasty.
The next report is from Serview. This is the pharmacy business manager that handles the prescription claims as secondary. And this tells us too on your generic utilization, which is on page 2 of that report. And the graph at the bottom here shows that your generic utilization is at 94%, which is excellent. So showing that you having that $10 copay for your generic prescriptions is, and then jumping to a 30 for tier 2 gives the employee that incentive to see if there's a generic or a generic equivalent. So you're running at 94% on generic utilization with the way that the plan was designed, which is excellent. And then behind the last tab, that's just all the reporting with Servview, is a copy of the plan design, how the plan works for the employee. And again, I mean, the benefits that you have for the employee here with their out-of-pocket are excellent benefits with your low co-pays, office visit co-pays, prescription co-pays, and then the $2,500 out-of-pocket. You've been able to keep this plan design for the employees for a few years now without having to increase have any employee contribution towards premium or increase the out-of-pocket for the employees. The next one is the dental. On the dental, those are claims that are paid through Freedom Claims, and the dental plan, you have the calendar year maximum of $2,000. You have 100% on preventive, 80% on basic and major after a $50 deductible, 2 per family. So, and again, the dental benefits that you have here are very good dental benefits. A lot of plans have 1,000 or 1,500 maximum.
And a lot of them go 100% 50/50.
They do.
So this is the difference.
Okay, we don't hear very many concerns or complaints, so it must be working well for everybody.
Good. And you can tell the numbers are working very well too. And like I said, if anybody has any questions on anything, that is what we're there for, is to answer those questions, give the provider a call, and here to service your account.
Okay.
Where does the reserves come from?
I'm not sure.
Okay, of the money that they pay, how does that reserves get to them? Or where is it?
Well, it's in the account that we reconcile. So with that bank account that you have here, when we send you the billing, then that money is transferred in there, and that's what we pay the claims out of. So on the savings report, when we do the reconciliation of that account, the reserve bank balance, we've added that column at the very right-hand side on what the amount is in those reserves. So when we bill you on a monthly basis, and actually the amount of the reserves is what was projected here. So we take that total premium less the United Healthcare, and the balance of that goes into the reserve account, and that is what pays the claims and what pays the administrative fees, and then the balance just accumulates. So it's that number there less the United Healthcare premium, what goes into the reserve account to pay claims and administrative fees.
And this is just Freedom Claims, correct? So then, is there more money we're spending on United Healthcare?
Yeah, the United Healthcare is included in this actual claim here. We include the United Healthcare premium. So that is the total of all components of the plan, the United Healthcare, the administrative fees, and the claims paid. So that's inclusive of everything spent on your plan for the medical and dental. Yeah, you bet. So when we come in and we do the projection, that includes the United Healthcare premium. So on this sheet here, now the detail of the claims paid is just what we have paid out in claims underneath that $6,350 deductible. But these actual costs here include the United Healthcare portion also. And Scott, what I can do, I've got a sheet that I can email you that does the breakdown where we come up with that premium. And it shows the United Healthcare premium and the administrative fees and then the balance that goes into reserves to pay that out of. So I can,
That would give you the.
it's kind of a it is a breakdown on how that premium. So we call it a reserve funding sheet. All right.
Another thing I'd like to do, Julie, is the next time we come to see the commissioners is there any way that we can show in the 3 years that this plan we've been doing this, what has been saved from what they had been paying prior?
Yes,
Is there-
we-
Okay, because that's, I think they could see that over a 3-year period. And that might give them a little bit better idea of what the savings has been for the county.
we can do that.
Well, that's gotta be astronomical considering the last company didn't pay nothing.
Yeah, luckily we got all those issues handled. It took us a while, but yes. But how the plan, yes, it was. How the plan design, you know, and setting up the two-card system, I know sometimes with the two-card, it can get a little confusing, but with the dollars that it has saved the county and the plan design that it's been given back to the employee, it's working very well.
All right.
Okay.
I agree, so.
All right. Well, we thank you for your time.
Yes, thank you.
And we will have all the 3-year history next time we come.
I just think it'd be kind of interesting to see in 3 years what it's netted for the county.
Yes. Okay?
Okay.
Thank you.
Thank you. Good morning, ladies.
Eric, can we take a 5-minute break?
Yes, sir. We'll take a 5-minute break. We'll be right back.
I did get one of them copies from Ken Rice's. I could get that.